Most appraisal input forms start with a blank form for you to populate 7 or 8 different categories with supporting documents. Unfortunately, the Ramsey system works in reverse, so you have to upload supporting documents and hope that the input form that is generated from that looks okay. So I want you to look at what your input form should look like when you've finished. The top of the form contains some administrative details, such as the scope of work, and this doctor has correctly attributed his scope of work such that the percentages all add up to 100. Next, you just list your medical qualifications. There then follows 8 different categories which you will need to upload supporting documents and reflections, or at least a statement about. The first category is continuing professional development. Evidence of your CPD in the form of a Royal College printout, or log with reflection on what you have learnt, or how it has changed your practice, is all that is required. You should have uploaded all the certificates of attendance under your supporting information. As a general rule, most colleges and professional bodies suggest that you should aim to gain, on average, 50 CPD points, or 1 hour's study, per year, and this is the level that your appraiser will be looking for. The subject matter should be relevant to your practice or your professional development plan. The second category is quality improvement activity. This section is intended for you to demonstrate how you maintain or have improved the quality of your work. The most obvious way is by clinical audit, but development of new protocols or techniques, research and committee work are also relevant. Writing guidance such as this is a possible example. It is here that I suggest you include your Ramsey InfoView report and similar activity and outcome reports from all other organisations where you work. You are also asked to please upload the letter from your hospital director confirming that there are no issues with your practice at any of the organisations where you work. It is important to provide appropriate reflection on any of those, and we'll talk in another tutorial about how to compile a reflective piece of information. The third section of your input form is significant events. That's not events that are significant to you personally, but they are events that are considered significant by the GMC, the Department of Health, or your organisation. In Ramsey, currently, that usually means events that have been uploaded to risk manager, or they might be never events, or they might be GMC reported investigations. You should include a reflection on all of these events if you have been named in a significant event. Remember, you're not on trial, but it gives you an opportunity to reflect on what happened and whether we can learn from it. The fourth section is complaints and compliments. Complaints will be included in your InfoView report from Ramsey institutions. Mostly, these will be those that are about you in particular, but lessons can be learnt from complaints about processes and systems, and you should consider your responsibility in helping to address these. All complaints about you must be discussed with your appraiser, with reflection on lessons learnt and change of practice if appropriate. Please see the video pertaining to how to write a reflection before you write your reflection. It's good to record and discuss compliments, but not necessary to upload all letters of thanks, etc. And make sure that no patient identifiable details are included here. The next section is colleague feedback. The GMC requires you to undertake a 360-degree colleague feedback by a recognised system at least once every 5 years. There may be times when it is recommended to be done more frequently. Other colleague feedback reflections can be submitted here if you've got a particular document that you wish to upload. The next section is similar but different, and this is Fae Patient Feedback. For doctors that are still seeing patients, Like colleague feedback, this currently needs to be done at least once every 5 years using a recognised system. It's not required for people who are not providing a clinical service, but it can be used for uploading a representative and small sample of anonymised patient thank you letters if you so wish. If you want to see how to anonymise a small card, please look at the video on how to scan a document. The next section might not be relevant to some of you, but a general timetable would be helpful, particularly if you have fixed commitments. The final section is academic and research. Although it's probably not relevant for most of you, any research or academic responsibilities must be included here. If you do have an academic appointment at an institute of higher education, you should discuss with your responsible officer whether a representative from your academic appointment should be present at your appraisal. In any case, a statement from them about your work and objectives should be included in this section. So that gives you a taster of what you're trying to upload rather blindly when you are submitting and uploading your supporting documents. So we'll look at how to upload supporting documents in the next video.